Okay. This is another part of the series, Mental Health Disorders Explained. Today I wanted to talk about somatoform pain disorder. It's a disorder with complaints about severe and persistent distressing pain, which cannot be found on a specific organic reason for. The symptoms are thought to be caused by psychological factors, and the disorder is focusing on the pain. So I recently talked about somatization disorder, where other physical problems are a problem, in such as dysfunction of the bladder, the gut, the extremities. However, here this is a disorder which focuses on pain. Usually there's some comorbidity with other mental health problems, such as somatoform disorders, depression, substance abuse, and personality disorders. Usually pain is a subjective feeling, and the quality and severity is usually individually experienced. So nobody can say that one has no pain, but it's also affected by mood and the meaning of the pain for the individual. Right. Usually pain, which when it's chronic, it becomes a different type of feeling, more numb feeling, and that's then a sharp pain, but that might be different in different individuals. There are not really good data in the population, but it seems to be in the percentage ranges. Usually in inpatients or patients who visit the A&E department, somatization or somatoform disorder and pain disorder are more common. Usually there are other disorders which can also cause pain. One might say angina, multiple sclerosis, different types of tumors. So these things have to be excluded. And so it has to be seen how this pain relates to the life events, to the feeling and presenting of individual patients, and how the family responds to this. Usually it's important to understand the patient, to find and treat undiagnosed depression. Some of the antidepressants work quite good in pain. So usually one sees what helps and doesn't try to explain too much. Just usually whatever a very practical approach might be helpful. CBT and trying to deal with pain, making pain bearable might be a good thing. Some patients respond very well to relaxation therapy, biofeedback, or hypnosis. That's usually the psychological approach. In other areas, it might be that pain clinics itself, which are run by anesthesists, might be an option. They can provide some antidepressants, transcutaneous nerve stimulations. They have these little TENS machines. They can have some local and regional nerve blocks with some anesthetic medication. Right. I would say I leave it at this with a somatoform pain disorder. I'd like to mention that ICD-11 has changed to subsume this somatoform pain disorder to bodily distress disorder, and so summarize all these disorders, including pain disorders, somatoform autonomic dysfunction, and severe fatigue into this type of disorder. I think a very weird thing, which I've really only seen myself a couple of times on TV, is body integrity dysphoria, where patients are keen to have an amputation to feel disabled as they find it appropriate for their personal well-being. This is so rare. I've never seen it, and I hope before I retire that won't be a problem for me, but I think these things can come up and can be relevant sooner or later. Okay, that's more or less it. Thanks for listening. If you have more interest in seeing these types of videos, please feel free to subscribe to our channel. Okay,